we're gonna do this in a few stages.
All
We're
right.
gonna start off with Jerry's arm in a neutral position here alongside the body, and we're gonna move fluid from the wrist through the elbow. There's also a bit of damage on the radial head. That's where the elbow struck the ground. Jam the humeral bone into the joint line, which fractured the humeral shaft. I haven't seen the images yet, but I believe it's a sort of telescopic fracture, so we have to give that time. In the meanwhile, we're going to work on swelling, which is the movement of the fluid through the wrist, elbow, shoulder as phase 1. Then I'm going to lift the arm up and do some small, gentle mobs, so we don't have to film all of this, but I'm going to be doing each of these stages for roughly 15 minutes.
Okay.
So we're going to be a total of about an hour of time. I'm going to do 15 minutes of movement of fluid, followed by 15 minutes of mobilization of the joint line. I can also, because the elbow's been a little problematic, rest it so I can grab above the elbow. That way there's no stress at the elbow joint itself. And I'm going to do clockwise circumduction, counterclockwise circumduction. Then I'm going to go slowly into this neutral plane. Right about 70 to 80 degrees, you're going to feel Jerry's arm hit a fairly blocky endpoint where the humeral bone doesn't want to rotate anymore in the glenoid fossa. And so I'll stop there and I'll feel Jerry out. Exactly, he just let go really nicely there. Yeah. Yep, and to pain tolerance and back away. Back into pain tolerance and back away. The nuanced thing that I'm doing with my left hand as I raise the right arm is to help the humeral bone slide down. So this is called inferior translation. If I'm rolling the bone up, I want it to slide down. And when it's injured, it won't do that, and it's boggy. So there's numerous reasons why the humeral bone won't want to do that right now. But so that we can mitigate some of the time of fibrosis that's going to take place around that humeral head from the trauma, we're going to try to help it by doing a little inferior translation myself. So with my left hand, I'm going to slip off the acromial bone at the top, and I'm going to touch the head of the humerus, and I'm going to push it downward while I roll the bone upward. And then the last thing I'll do is we're going to work on the posterior capsule position, which is let the arm fall across the front of the body here. And later on, if I film this all the way to the end, we're going to notice that Jerry's arm isn't so bent here. The humeral bone's hung up. It doesn't want to fall across the front because it hurts. But later I'm going to soften this. It's going to be loose from all the other procedures, and that arm's going to fall much nicer across the plane of the body. And that's essentially what we're going to do. The last thing I would also add would be a little assisted or active assist motion. So I'll lift Jerry's arm up to its highest position. Now Jerry, hold it up if you can, okay? Hold, 2. I'll back away my help to see if you can hold it, and then relax. And maybe hold a 3 to 5 second count. That's gonna turn on the deltoid muscles and the rotator cuff group so we can get those activated while this is all healing, and we'll cut off a lot of time at the end of where we don't have to work on all these things individually later.